Hey guys, Dr. Cliff here with HearingLoss.com, and in this video, I'm talking about tinnitus, what causes it, and how you can treat it. Tinnitus, or tinnitus, however you want to pronounce it, is commonly known as a perception of ringing in the ears without an external sound causing it. However, not everybody experiences a high-pitched ringing sound. Some people perceive the sounds of crickets, cicadas, static, a whooshing sound, or even a roaring sound, and they can perceive multiple different sounds at one time. Technically speaking, there are two different types of tinnitus. One form being subjective tinnitus, where the perception of the tinnitus can only be heard by the person who is experiencing it. The other form is objective tinnitus, where the sound can also be identified by somebody else, often a medical professional. Here are some tinnitus statistics that might surprise you. Nearly 15% of people worldwide experience some form of tinnitus, and approximately 1 to 3% of these people have debilitating tinnitus. Tinnitus is the #1 disability reported among returning service members, just ahead of hearing loss. In fact, 90% of individuals with tinnitus also have an underlying hearing loss. And nearly 16 million people seek medical attention for tinnitus in the United States annually. There are a few common theories behind why tinnitus occurs. One of those theories is that the absence of sound making it from your ears to your brain due to an untreated hearing loss is causing the brain to create its own phantom sound to replace it. Another theory is that the proximity of your carotid artery in your neck is so close to your ear that you can perceive the sound of blood traveling through your artery as your heart beats. But perhaps the most concerning possible cause of tinnitus is a tumor growing on your auditory nerve, which is why if you have tinnitus in only one ear, you need to see an audiologist immediately. While there is no single documented cure, there are a number of effective tinnitus treatments that can significantly reduce your perception and annoyance levels to the tinnitus. One of the most common treatment options is hearing aids. By addressing the underlying hearing loss, approximately 60% of individuals with tinnitus experience a significant reduction in tinnitus levels. Another form of treatment is called masking. This is when you use external sounds to mask over the perception of your tinnitus. I do this myself by turning on a fan at night so I can fall asleep with the tinnitus that I have in my right ear. One tinnitus treatment that's gaining a lot more traction here recently is called bimodal neuromodulation. This is when you use sound therapy combined with tactile stimulation to reduce the symptoms of tinnitus. Okay, so the big takeaways that you should be getting from this video is that tinnitus is extremely common, and a treatment that works for one person may not work for another person, which is why if you have bothersome tinnitus, you should seek out the help of an audiologist who specializes in tinnitus identification and treatment. Alright guys, I hope you enjoyed this video. If you did, please hit that like button and make sure that you subscribe to the HearingLoss.com YouTube channel for more content, and I'll see you in the next video.